I'm a big skeptic of this therapy. I thought, okay, it's sort of just a way of making money off people, you know, sort of like there's a lot of people in the autism world who come up with all kinds of medications and foods and additives and everything. I sort of put it in that category initially. So I decided I wanted to come out myself to experience it a couple times. At first I thought, well, what do you learn if you don't even ride the horse, you know? What can you learn from a horse without riding it? But actually it's more beneficial not to ride it, because the horses that have been ridden are sort of trained to be ridden, while these horses are sort of in nature, and they're going to respond to you in the rough, which is what these students need. So I wouldn't want horses that are trained to be responding to the students, because they wouldn't get a real impression of how they're being with the horse. So when I came out to the ranch here, I was a skeptic, like I said, and so Dr. Wise just threw me right into the tank with 2 horses and said, okay, just try to keep them apart from each other. What came to mind was I was trying to get the horses to do what I want them to do, and I was trying to control them, and I thought, okay, well, I can do this, you know, just get between them, wave my hands, and separate them out. And the more aggressive I sort of got with them, the more skittish the horses got. Okay, it's not going to happen, huh?
So what's your assessment of the situation at this moment and the possibility of you getting that done?
I'm going to have to change what I'm doing.
Okay, very good.
Because they're hanging together and they're scared of me. Horses are hypervigilant all the time. They're constantly looking at anything new that comes into their view, and they're sort of skittish all the time. So it's sort of a way of reflecting again to me how I enter social interactions. Right? If I start running them, they'll just get more skittish, won't they?
Very good. We could have you try that, but I think you're already aware of energy level.
For people who have trouble and don't understand social relationships, it's like a minefield out there. You don't know if someone's going to be loud, if the group is going to start yelling, if they're going to get all emotional and everything. And that's something that we don't like. We want the sameness as much as possible. He seems to be reacting to the other one's skittishness.
Does he look anything close to being willing to come up to you?
No.
No.
How that impacted me immediately, because I guess because I've worked on myself so much, I saw the implications of it in my relationships. I said, okay, this is typical of you, Michael. You want what you want when you want it, and you want it. You don't want it. You want to skip all the. You stay here. You know, the foreplay and the social relationships. You just want what you want, and it's typical male behavior probably, but even more so for people on the spectrum, in the sense that we're very goal-oriented if we get our minds made up on things, but you can't approach relationships that way. You have got to feel your way through. I was able to talk about that with Dr. Wise as soon as I left the pen, and I thought, well, geez, how did I get all of that out of, 25 minutes in the pen? That was pretty remarkable.